welcome to another episode of Going All In, Get the Edge You Need to Succeed. I am Dr. Erin McKinley, and today we have another awesome spotlight session with Jeanne PigaPlunkett from the MPH and DI program with the UTHealth School of Public Health based in Houston, Texas. Welcome, Jeanne.
Thank you. I'm glad to be here.
So before we dive into the program at UTHealth, tell us a little bit about you and how you landed there.
I've had a full career. My name is, as we mentioned earlier, Jeanne PigaPlunkett, and I have been in, I hate to say it, the profession for over 40 years. So I've had a very full career. I started my undergraduate, I graduated from the University of Texas, Austin, and got a Bachelor of Science with a major in food science. And then I went on to get my master's degree at Texas Women's University here in Houston, and I got a master's in clinical nutrition. I started working in corporate wellness in the 80s, and that was relatively new. No one was doing that, and I was working for banks, so it was very unique. And the bankers wanted to stay healthy, and then we had an oil crisis, and I did not have a job any longer. So then I moved on and continued working, and I got a job in rehab, which was new and it was upcoming because they didn't start it. It's not been around forever. And then I moved on to do child psychology. And then I moved on to do school food service, where I spent the bulk of my career. And I did private school food service. So it was a little bit different, and I got to be a lot more creative than what you get to do in public school food service. And after that, my husband got a burning desire to go to Princeton, and so I moved to Princeton, where I worked with the PACE program, which is all-inclusive care for the elderly, and it's keeping your elderly patients at home and healthy, and it was very innovative. And then we moved back to Texas, where I worked with Brighter Bites, as well as the Houston Food Bank. And then I moved on to working as the Dietetic Internship Director here at the University of Texas. So it's been a fun ride, and I have a lot of experience, and I believe that's the reason that they chose me to work as the Dietetic Internship Director, because I had so much experience and could relay all the different things that students would go through as an entry-level dietitian. So as we get started, the University of Texas Health Science Center, the School of Public Health. This is the Dietetic Internship Program, so let's get started. We have a dream team. I have several different instructors that I work with. I have Laura Moore, who's the Executive Director of our Nourish program and the Assistant Director of the Dietetic Internship. I have Dr. Susie Day, who is in epidemiology, and she's also a health promotions, health education faculty member, and she's a primary investigator here with the university. I have Shannon Weston, who is a CDE and our community liaison. We have Dr. Wesley McWhorter, who is our chef with the Nourish program. We have Dr. Deanna Helsher, who's the Dean of the Michael and Susan Dell Center in Austin, and she is one of our faculty members as well. The Dietetic Internship is actually, as Erin had stated, is located in the heart of the medical center here in Houston. And this medical center includes 54 medicine-related institutions. We have 21 hospitals and 8 specialty institutions. We have 8 academic and research institutions, 4 medical schools that we work with, 7 nursing schools, 3 public health organizations. There's 2 pharmacy schools and 1 dental school. And the reason that I bring up all of this is that we do a lot of interprofessional programming, and our dietetic interns are working with both medical students, nurse practitioners, and dental school, and the dental school in culinary medicine. So we do a lot of things where we're working with other medical schools, and our medical schools see how professional our dietetic interns are and what they have to offer as far as health and keeping patients in good standings. Our dietetic internship is a combined master's program and dietetic internship. As you're working through this program, you'll receive 45 hours, which include your dietetic courses for electives, and this is an extremely rigorous program. We are accredited by Ascend, We participate in die-cast every spring. We also participate in pre-select, and I will go through that in just a second. We accept 12 student interns, and our program is 22 to 24 months long. We have a break at Christmas and a break at the end of our summer session, but our practicum does go through spring break. And I like to mention that because it's a cruel thing that we do to our students, because we teach them that spring break is always there, and when you start working, it no longer exists. So I like students to know up front that you do work through spring break. The reason that our program is anywhere from 22 to 24 months is that some students decide to go through the Archer program and may choose to do a thesis or instead of an ILE, and it can extend them by 2 months. We do go through SOFAs. It's a dual application process for us. You must apply to both the School of Public Health as well as go through the die-cast process. Our deadline for applications is April 1st. You would apply under Health Promotions, Health Education, the Dietetic Internship. Now, the thing to note is that February 14th is when your die-cast application must be completed if you're going to go through the die-cast process. Therefore, if you're going to do the School of Public Health, it's to your best interest to have both your School of Public Health application and your die-cast completed at the same time. A critical date for our students, especially out-of-state students, is December 1st. The reason that this is a critical date is because if you're going to go through pre-select, and pre-select allows you to be selected into our program before the die-cast process. But you have to have your information in by December 1st, and that comes very, very quickly when you're in your senior year. But if you do meet that December 1st deadline, you are eligible for pre-select, and you're also eligible for scholarship monies if you qualify. So not only do you get to be selected and not go through die-cast, but you also are eligible for scholarship money. If you're part of the University of Texas system, you could go through pre-select with a deadline of January 15th. That wouldn't be here because you guys are from LSU. Supervised practice hours have changed, and we have a minimum of 1,000 supervised practice hours, and in order for you to sit for your RD exam. One of the things I'd like to point out is that because you're going through our program, you're also getting your master's degree, which will allow you for promotions, and in 2023, you would have to have this in order to sit for the RD exam. So they work together and they go hand in hand. Now, talking about our supervised practice hours, we only provide supervised practice hours in the spring and in the summer semesters. In the spring of our first year, our students go through a community, a hospital, and a school food service rotation. Our schools include Houston Independent School District, Spring ISD, Cy-Fair, A-Leaf, Aldine, Dickinson, and Klein. Our community rotations are with our own program, the Nourish program, Brighter Bites, the Houston Food Bank, HEAL, which is Healthy Eating, Active Living, and it's a grant. We have community rotations at the UT WIC Center. We have community rotations at Houston's Health and Human Services, the Dawn Center, which focuses on diabetes prevention, Methodist Wellness, and we have a milk and honey entrepreneur that we work with as well here in Houston. Our hospital rotations are all and this is hospital food service as well as our clinical rotations, are at Memorial Hermann Hospital System, Methodist, Texas Children's, St. Luke's, MD Anderson. We work at Harris Health Facilities, and we have several long-term care facilities that we work at. The students get to choose their community rotations, but I place you in your school and your hospital food service rotations. And then in the second spring of your 22 months, I place you based on your ability and your performance in our MNT and our simulation lab in a hospital that will meet your needs and make you a better entry-level dietitian. We do have specialty rotations, which the first 6 to 8 weeks are in a hospital, and then we let you choose where you would like to be as far as a specialty rotation. And we have rotations at Texas Children's, we have employee wellness, we have diabetes specialty at the Women's Center at Texas Children's. We have a renal, we have two renal facilities that we go to. Nutrition Research Center is located here in Houston. We have rotations in sports nutrition, GI specialty at Memorial Hermann Hospital System and Texas Children's Hospital. We also have liver specialties at Methodist and Texas Children's. One of the things about a specialty is if you had or asked to do a rotation that you found or that you were interested in, I would put an affiliate agreement out and try and get them to accept you as a student. And what we have done in the past, so you have an idea of some of the things that we've done, is we've worked with the Academy, and our students in the last 3 years have gone to Washington, D.C. to work on policy and procedures at the Academy level. This past year, our intern actually was published in the Academy Journal for the work that she did. Another specialty rotation that was interesting was a student wanted to work on a food truck, and she found a dietitian here in Houston that owns a food truck and catering business, and she did her specialty rotation there. It was very interesting. It was very different, and she really enjoyed it. Another specialty rotation that is a little bit of a distance from the city of Houston is Chef's program in San Antonio. Our facility and our Dietetic Internship has a big culinary medicine program. So for students who want to teach food as medicine, this is a wonderful program. But one of the things that we did was we actually placed students in the culinary center in Houston, in San Antonio, where they worked with chefs at the Culinary Institute and taught chefs how to prepare food in a more healthy manner. So it's been interesting, it's been a lot of fun, and our students have come up with some very creative ideas as far as these specialty rotations. So if there is an RD present, it's something that we can definitely work with. Our dietetic courses include public health nutrition, nutrition research methods, culinary medicine, garden for health, medical nutrition therapy, simulation. We do a diabetes seminar, we do a pediatric seminar, and then we do our practicums that include all of our different rotations. One of the complaints that students have had in the past was, or one of the complaints that they had, was that they didn't get to select a lot of electives, because your electives are the courses that are involved in your supervised practice, as well as getting your certificate in nutrition and public health. So it's very, very rigorous. It's all planned out for you, so there's not a whole lot of wiggle room. If students wanted to take other nutrition courses, they can, but they would be added onto their 45 hours. This is our facility. This is our garden. We actually have a butterfly garden, and we have it's about a quarter of an acre garden right here in the heart of the medical center. So our students will learn about gardening, and we'll go from seed to plate, and then finally do a full circle with prevention. It's real interesting because the MD Anderson circles this entire garden, and we will get a lot of MD Anderson patients that can go outside and just want to breathe green instead of breathing isopropyl alcohol, because that's what it smells like in MD Anderson. And it's a place for them to find refuge from the hospital system. They'll come in, and our students will take them on a tour, and frequently we hear, how they just like to come and visit and just get out of the hospital system. So it's very pleasant, it's very lush, and our students help with this gardening process, and they actually take the class Garden for Health, where they learn about the nutritional values of planting and growing your own fruits and vegetables. We also have a state-of-the-art simulation lab where we have a 3G mannequin, and I have 2 photos here. And our students work for 16 weeks doing the nutrition care process as well as nutrition-focused physical assessments. They work on 16 case studies, and we take them through all the different disease states and have them work and visit with a patient. The last 3 weeks of our course, we bring standardized patients, so they go from working with a mannequin and getting comfortable with this nutrition care process, and then they get real life patients that will come in and talk to them as opposed to the voice on the other end of the mannequin. So it's a lot of fun, and it's very interesting, and it gives you that step up so that when you go into a real life situation, you're competent and you feel comfortable with what you're doing. We do a lot of cooking demonstrations here, and here you're seeing our students get hooked up for doing a live stream. Right now, all of our cooking demonstrations are virtual. We do a lot of cooking demonstrations for the School of Public Health. We work in culinary medicine, and our interns go through a culinary medicine course, and then after they complete the course, they come and they work alongside of medical students, dental students, nurse practitioners, and they actually lead their group in the culinary demonstration and discussion as far as their case studies. And their case studies for the medical students, dental students, and nurse practitioners are a little bit different than the ones that you would do in the simulation lab, but it shows how important food is and how it plays a role in prevention. And coming to the School of Public Health, we work on a lot of prevention. And it's been very interesting, and it's a lot of fun, and it's interesting to see how much more intelligent some of our dietetic interns are compared to our entry-level med students and dental students, because they definitely know their stuff. Here you can see they're working, and this is another presentation, and here they're actually testing recipes and testing food from the garden, and it's a lot of fun. It really is a learning experience, but it is fun. We do have good times here, and if you see our students, this one on the left-hand side, we were getting ready for Halloween, and we were using the candy for part of a display. But on the right-hand side, you'll see our student, Julie June, and she's showing one of the melons that we actually harvested from the garden. And it's very interesting because she's featured in fencing this year in the opening session. So our interns go to big places and are very competent and very, very capable as they lead this program. Frequently asked questions. We do participate in Baylor College of Medicine's Pediatric Fellowship, and one of our students and one student from TWU is accepted into this program, and they go through a NICU fellowship and get paid, and they'll do it for their specialty rotation and 2 months out. We have 100% pass rate for our master's program. In the last 5 years, we have 100% pass rate for our CDR exam. We only participate in the spring die-cast selection process. Each year we have about 3 applications, approximately 36 applications for our 12 positions. Last year we had a record number of 65, and 40 went for pre-select. Our GPA, a minimum of a 3.0. The GRE this year is going to be waived, so that's not relevant. When we do our selection process, we look at the overall person, we look at your transcripts, we look at your experience, and we look at your volunteering. It's very easy to get a 4.0 if you don't work, and so but that's not the only criteria that we look at. We look at those experiences and volunteering. It's very, very important that our students can handle both schoolwork as well as work, because we do a lot of extra things. Right now we have a research grant, and our students are working with that. We get called many times to be on television, and our students are the ones that we put on the air. We will get requests from magazines to answer nutrition questions, and we let our interns do that, and we also let our interns take the credit for that. So we do review it for them, but we let you as students do that work. So it's real important because you need that experience as you move on into your career. So that's the end of my presentation. I think I've covered most things. Do you have any questions for me?
That was great. Thank you so much. That was super informative. I learned more about the program. I thought I knew a lot, but I learned so much more. So I have my 5 questions that I ask all directors that come on the Spotlight sessions with us. And these questions were compiled with the help of some of our students, kind of finding out what things they really want to know from directors about their program. So the first question is there a particular thing that you love to see in an applicant's personal statement?
The thing that we really need to see as you apply to the School of Public Health is how you are interested in public health. If you focus on clinical rotations and stuff along that line, that's fine, but they really want to see public health and why you're interested in public health. Why would you choose public health over another program?
All right. So this second question is a true or false question, and then with a little bit of explanation on what you decide to say. So an applicant's resume should always be 1 page and 1 page only.
True. Because we want to see what you've done, but we also have quite a few applicants that we have to go through. So when students start writing about their passions and stuff along that line, that's fine in your personal statement. But with your resume, we just want to see what you've done, and we really want to see what you've done focusing on nutrition, dietetics, and things that have been relevant to you deciding that career.
So you would prefer that they kind of put as much into the application itself as they can fit and then just keep the most?
Yeah, because we really go through the application much more than look at the resume. I mean, we'll look at it, but your application should reflect that resume pretty thoroughly.
Okay. So question 3 is, what is one thing that an applicant may do that's a total deal breaker for you? So something they either do when you talk to them, you meet them, something they can put in their application where you're just like, I don't think that this would be a good fit.
A lot. There are things that students can do and look at our website and really know who we are. And when we speak to those students, because sometimes, we have 12, but there may be some that are like I say the bottom 6, but it's not the bottom because all of our interns are good. But like you may have 6 that you really, really like. And then you may have 6 that you see something there, but you're not sure how they're going to react. So we might do a phone call or an interview. The thing that's interesting is you need to know about our program. If you don't know about our program, and I've had students that I have called and said, tell me why you're interested in the program, and they're reading everything off of my web page and not telling me how they're involved or what they want to see or do. We're kind of turned off by that. We want to know why you're passionate. We want to know why you're interested in public health. And we really want to know that you've investigated us and look at our website. If you follow us on UTHealth, as far as our internship, you'll see a lot of interesting things, and you'll see how our students are involved in everything. We just did an IDDSI program with our second years, and we got 700 hits on our webpage, and it was just real interesting because the combination of what the students were doing was pretty interesting. So you can see some of the stuff that we do. We do a lot of hands-on. We don't, theory is good, but if you're teaching IDDSI to your food service staff or you need to know about it, you need to know how to do it. And so we'll practice those kinds of things. And we bring in the experts to help us, so that you are confident and know what you're doing when you go out and if you have to meet with somebody who has dysphagia.
All right, perfect. So the fourth question is, what is one area of the program that you're actively trying to make even better for interns?
Well, you know what? There's two areas that we are constantly working on and making, and they're both very interesting and they're fun. But we do culinary medicine, and in culinary medicine, we show how food is medicine and how we can do a lot of prevention. And where our students are involved is that they're actually helping us teach the medical students. So when we first started out, we were kind of feeling in the dark. Now we've got the program and we're seeing how much impact we have. We've just added the School of Dentistry. We're looking at nurse practitioners, and we bring the dietetic interns in so they have a role, and those medical students see their role as a dietitian and can answer the question. So you're more visible to the medical student. So then they understand what the dietitian does and what their role is in the hospital, and we don't just take food orders. Okay. So, they see your relevance and how you fit into the interprofessional skills. The other thing is our simulation lab. When we first started out, we only had a couple of case studies, and now we've got probably about 30, and we're working on more, and we tweak them and we make them relevant. Right now our patients are coming in and they have COVID, so our students are looking at how they have to dress, what they have to do, and just the process of the nutrition care with these different disease states as they come up.
Perfect. All right, so this last question from me is a two-part question. So the first is, what would be the 3 best adjectives or descriptors to describe your program?
Interactive. Interactive, innovative, and rewarding.
All right. So the second part is 3 adjectives or descriptors to describe your ideal applicant.
My ideal applicant: passionate, motivated, hardworking.
Perfect. All right. So we got a question in the chat from a student. So it says, you said GRE scores are waived for this year's applicants, but will students who submit their scores be given any kind of preference over those who didn't?
Oh, they will. I mean, we if they're available. Part of the reason that they have been waived is that several students. I mean, they're having difficulties taking the exam, but if they have them, they'll definitely be used.
All right. Perfect. Do we have any other student questions that they want to pop in the chat? So speaking of COVID, so what did you have to do in the spring, or what have you had to do to really make sure the interns are still getting their hours or some experience if they can't be on site?
Because we have the nourish program, and the nourish program actually does a lot of research. That they're the ones that sponsor the medical students and stuff along that line. We were real fortunate that in the spring, all of my students had completed everything that they needed to. But our first years had some difficulties, and so what we did was we created some alternative learning. We've done workshops. We've done all different kinds of things where we've kept our students safe and in the classroom, and provided. I mean, our students do a in the summertime we do a pediatrics camp that still went on. It was virtual. We do a diabetes camp that was virtual. So we've done a lot of different things. Everything seems to have gone to virtual and it's online, but they still were able to get their hours.
All right, perfect. So what are some places that interns, after they graduated, what are some of the places they are working at now?
Texas Children's. We have some at Harris Health. We have several different students that we have one that is a blogger. We have one that they've all been employed. We have one that's gone into culinary medicine and went on to get his DRPH in food science, and then because he really wants to work in culinary medicine. Most of them start at a clinical position. Many will go into the community. It's not mandatory that they have to start a clinical, in a clinical setting, because our program is so full and well-rounded. Our students have pretty much gotten jobs where they really want them. We've been real fortunate. In the last year, and we had 11 graduate, we had 4 of them that are in clinical not in clinical rotations, but in clinical settings, and we had 5 of them that one is going for his DRPH, and the other 4 are working out in the community. So Houston Food Bank, policies and procedures. We've got school food service. She got a directorship at a small school. So everybody's been employed. We've been, real fortunate. Houston's pretty big, and so there's a lot of opportunities out here. All of our students have stayed here in the Houston area at least for a year to 2 years and have gotten experience and then venture out. So it's not mandatory, but a lot of them have.
So is the MPH program set up so that students can also qualify for the Certified Health Education Specialist exam?
No, it's not.
Okay. All right. And then, let's see, do we have any other questions from the students popped in the chat? I don't see any. So what is one last message you want to give any potential applicants this year?
Well, I hope you'll consider us. If you do consider us and you'd like to take a trip down to Houston, just let me know and we'll take you on a tour. And I think if you see the facility and see what our resources are, it would be make you a little bit more passionate. And when you see where the School of Public Health is located in the heart of the medical center, it's real motivating because you see all different kinds of things. If there's a project going on that's related to health and nutrition, it's here in Houston. So there's a lot to offer. It's a huge city. We're kind of a concrete giant, but there's a lot to be offered.
Awesome. Well, thank you so much for joining us today. It was really great having you, and I encourage our students to look more into the program. And for those at home, if you want more information about the MPH and DI program at UTHealth, or to reach out to Jeanne, just check out the link to their program in the description below. I've also linked a promotion video that Jeanne would love you to watch. And don't forget to like this video and subscribe to the podcast so you never miss an episode, and we'll see you next time.
Sounds good. Thank you. Thank you.
Thank you.